A new report endorsed by Puerto Rican officials finds Hurricane Maria was the deadliest natural disaster for Americans in over a century. The study calculated that 2,975 people died as a result of the Category 5 storm from last September. The initial estimate by the Puerto Rican government was just 64. That total surpassed Hurricane Katrina and puts Maria among the deadliest natural disasters in U.S. history. President Trump addressed the federal government's response to Puerto Rico today.
Yeah, I think we did a fantastic job in Puerto Rico. We're still helping Puerto Rico. The governor is an excellent guy, and he is very happy with the job we've done.
Well, earlier, CBS News correspondent David Begnaud spoke with Dr. Lynn Goldman, the dean of the Milken Institute School of Public Health at George Washington University. That's actually where the report came from. And also with Russel Honore. He's a retired lieutenant general in the U.S. Army and a former commander of Joint Task Force Katrina.
Dr. Goldman, the first question is for you. What are we to get as a lesson from this report?
Well, I think it's very, very important to understand that Hurricane Maria, which was of enormous magnitude, had a tremendous impact on all of the people of Puerto Rico. And unfortunately, part of that impact had to do with 2,975 deaths estimated to have occurred, lives lost because of the storm. And not only the immediate impact of the storm, but also the fact that over a number of months that there continued to be impacts on the population because of loss of electricity, problems with shelter, food, water, and impacts that were especially felt, most severely felt, by those who are of the lowest income, the elderly, and especially elderly men.
Let me ask you this, Dr. Goldman. Why did researchers look at the 5-month period? Why did you widen the window to 5 months?
We actually looked at a 6-month period from September through February, and we were interested in looking at a wider window because we hoped to capture the entire time period over which there may have been elevated rates of people dying, unexpectedly high rates. Unfortunately, we didn't quite catch the end of it. There were still increased levels of mortality, of death, even in February of 2018. So we lost the very tail end of the epidemic. But we did have a sense that the disaster was particularly prolonged because of the way that the island had been impacted in terms of all services, power, electricity, food, shelter, water, being negatively impacted by the storm.
General Honore, I know you've closely been following what happened here. You were in Puerto Rico. I remember seeing you here on the ground in the first couple of weeks after the storm. How did the government's initial response compare to what you saw in New Orleans when you were there leading the federal troops after Hurricane Katrina?
Well, I think the government takes credit for having about 12,000 federal workers and soldiers, sailors, airmen, and Marine on the ground at the highest point. And in Katrina, within 5 days after the storm, we had 20,000 federal troops either there or on the way. And by Friday of Katrina, 4 days after, we had over 240 helicopters, as well as 40,000 National Guard committed to Katrina in Louisiana and Mississippi. Now, getting that support to Louisiana and Mississippi you can do it about 2 days quicker than you can go into the island of Puerto Rico, but it still could have been done. But that was not a course of action that the federal government elected to use. They elected to use federal workers and just the local National Guard. And of course, the storm had a vote. It broke the grid, it closed the port and many roads and 40 bridges. But this is why we have a government. They should have planned, they should have had a task force follow the storm in, David. And that is my discouragement, that did not happen. But in a storm like this, what makes it a real disaster is that you lose. We're going to lose people. We're going to lose infrastructure. That being said, I hope we are better prepared for the next storm that comes to Puerto Rico, and we have a federal military task force that follows the storm ashore.
General, it just so happens that we are talking to you today on what is the anniversary of when Hurricane Katrina made landfall in New Orleans in 2005. 1,833 people died after Katrina. And a lot of people, Dean Goldman, to you, are comparing this to Katrina, saying, well, now Maria surpasses Katrina. Is it fair to compare Maria to Katrina in terms of a death toll?
I think it's fair to make that comparison, although the methodology that was used for estimating the lives lost after Katrina has been different. We have been working very hard to do a better job to get a full accounting of the lives lost, not just those that are directly caused by the storm, but also those that are indirectly caused by the storm. We learned a lot of lessons from Katrina in terms of the fact that many people who are medically vulnerable need to have extra levels of protection, need to be told to have their prescriptions, take their prescriptions with them so that people with chronic disease are treated. And unfortunately, all those lessons have not been applied. And I would say not just Katrina, I would point to Sandy, I would point to Harvey, as well as with Hurricane Maria, that the things that have gone wrong in terms of making sure that those who are most vulnerable are protected, we haven't taken all those lessons to heart in terms of making sure that we're there, as the general said, to have the personnel there to protect the most vulnerable, but frankly also so that our medical systems, our health systems, our systems to provide emergency food to people are taking care of those who are most vulnerable, those who have chronic diseases, the elderly, those who are of lower income and don't have personal family resources.
Reached the conclusion of 2,975. That's what people here on the streets of San Juan are asking me. What was the methodology that they used to get that number?
So we did a very thorough examination, not only of all of the reports of death, but also we evaluated all of the data about migration in and out of Puerto Rico over the years prior to the storm, and also after the storm, when a lot of people left the island. We also looked at the variation with seasonality, because after all, we're talking about a specific part of the year between September and February, when you often might see greater rates of death during that season. So we knew we needed to make sure that our models took that into account. We looked at other things in the model as well, age and sex and socioeconomic status. So it's a fairly sophisticated statistical modeling to say that this is the excess number, which is to say also, I can't tell you exactly who those people are. Among all the people who died during that time period, we want to do a next phase study where we get into the individual cases, find out more about the circumstances. We better protect people in the future. There are going to be more storms. We know that we're seeing
response. General, I got to tell you, you'd be hard-pressed to find a majority of people here on this island who are proud of the federal government's response. I want to know from you, sir, given your federal response experience, do you think that the federal government did a good job here in Puerto Rico?
No, and I think FEMA's just about admitted that in the after-action report. They're not politically empowered to say that because they tried to put give this the best face. But the federal response was slow. It never was scaled right. And look, a disaster like this, what makes it a disaster is it breaks things. Everybody knows it's going to be slower. But I got on a Delta Airline plane in Atlanta, and I beat the Army general there that was coming in to take charge. What in the hell is wrong with that picture? The military was asleep at the wheel. NORTHCOM was asleep at the wheel. And we were playing this footsie game between NORTHCOM and FEMA. When you ask for us, we will come. That's not the way the national format that we operate with that was approved over the last 13 years read. The military is supposed to be prepared to go save lives, and they were waiting to be asked to go save lives. And by then, it was too late. With only 2 ships in the region, it's a crying damn shame. And I hope the next time we have a storm coming in the Caribbean, the military will follow the Irma model. They did a good job following Irma in, but they did a sorry job responding to Maria.
You know, if
Dean
I could
Goldman,
add something.
you said yesterday after the report. Go ahead. Go ahead.
Oh, I was going to add something in terms of the doctors and nurses and other healthcare providers on the island, which is that they've worked really hard, and I think they did a really good job. And in terms of how they register the deaths, this is a problem across our whole country. We need to train, not just in Puerto Rico, all of our healthcare providers. But you had a question. I'm sorry.
Well, no, it's a good point, Dean, because I want to point out in context, it's not just a problem in Puerto Rico. As you said, it's across the mainland. But Puerto Rico has the potential to become a model for states on the mainland in teaching doctors exactly how to properly certify deaths in natural disasters. My last question for you, Dean, is this. I saw a quote from you where you said yesterday that you weren't sure whether the government would be able to implement the suggestions that your university has put forth. And there were many pages of suggestions. The governor has created a commission, but what do you mean by you're not sure if they'll be able to implement it?
Well, I think one of the major concerns has to do with the fact that the government doesn't have complete control over its own finances. And I think it's going to be very, very important to make sure that those who do control the finances understand what needs to be done for public health, public safety, for preparedness for future disasters, and that they're willing to, if you may, let loose the purse strings and invest in these preparedness efforts, or they will not occur.
General, the last word is yours.
This is the landfall day of Katrina 13 years ago. And as we reflect on the high number of deaths in Maria, it's incumbent on all Americans and people around the world to be prepared. Our infrastructure is broke. We've got to be more resilient. We keep looking at when is the hurricane going to hit Miami? It's going to hit it. It hit Houston last year, and it could go back. And David, we continue to build in the flood zone. We'll continue to make some stupid mistakes that expose people. And along the coast, right in the eye of the storm, and then we are late to evacuate, and we're late with the response. We must do better. We need to talk